Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? So, from colic to constipation, sleep struggles, torticollis, plagiocephaly, tummy aches, leading into their older years of sensory struggles, right? ADHD and anxiety. The list seems never ending. What we are seeing today in offices all over the country is that the paperwork always has one common denominator. Moms say things like, I was so stressed out during pregnancy, or I had such a traumatic birth. I remember the doctor having to pull so hard to get our baby out. Other things we've heard are, I lost a loved one while pregnant, or this is my rainbow baby after numerous miscarriages. So stress, and more stress. So how can we help ease this stress for both expecting mothers and their soon-to-be new babies? Obviously, we can't control what happens in life, but we can help the nervous system be able to work through and process this trauma easier so that both mom and baby will be more adaptable and resilient to all things that life brings, hoping to possibly avoid some of the common symptoms that I mentioned just a few moments ago with babies after birth. So my name is Dr. Matt Dirkse, and I specialize in neurologically focused pediatric and family chiropractic care. If you're an expecting mom or want kids in the future, keep watching this video, as we will talk about how you can start influencing your child's nervous system even before conception or they're born. So this video is for expectant parents, those planning to have babies in the future, families who want more babies, and anyone curious about how to have the best pregnancy and help learn more about the development of your baby's nervous system. So we're diving deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system development within utero. You'll learn how things like the vagus nerve influence your baby's growth, why it matters for long-term health, and how you can support optimal development during pregnancy and beyond. So at Health Zone Chiropractic, we specialize in cases that involve birth trauma. Sweet babies come in who struggle with colic, eczema, sleep challenges. We also have toddlers and elementary age kiddos who suffered from these challenges as babies and then have grown into diagnoses like SPD, ADHD, OCD, ODD, and autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, or a traumatic birth. These three things are very likely, especially with how medicalized our country has become with prenatal care. So let's look at some stats to paint the full picture. So America spends close to $100 billion on birth per year. So that's 1 in 3 American women have C-sections. World Health Organization recommends 10 to 15% at most and has deemed it a true medical emergency. 75% of American women receive an epidural. 31% of women are induced. 1 out of 7 American women experience a postpartum mood and anxiety disorder. Fertility market in 2022, $7.9 billion. 2028, projected to be $16.8 billion expense. 65% of women are on hormonal birth control. I am so grateful for emergency medicine in the US, right? We are number 1 in the world for emergency care, no doubt about it. Unfortunately, for maternal and infant outcomes, we rank almost dead last at 55%. Again, not everything is in our control, but as a whole, something isn't quite right here, folks. So medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth, right? For low-risk pregnancies, too much interference is happening, leading to a cascade of events we call the perfect storm, which are all of those common symptoms and diagnoses that we are seeing time and time again in our office. So how can we best prepare our mind and body for pregnancy and birth so that we can have the best outcome possible for birth mom and baby, right? Let's go through 4 tips. Stick around because the 4th tip is going to be the most impactful here. Tip number 1, empowerment and knowledge. Have you ever heard the saying, birth is 80% mental, 20% physical? When people told me this before, My wife had a baby. I never believed them, right? But after prepping birth and studying for it, she had a dream, right? A dream birth. And that's when I did believe it. The 20% comes right at the end when you completely surrender, she did, her body, and let it do what it was meant to. When you are more educated, you know more and will do the best you can. Tip number 2, start to prepare even before conception. This is for couples who know they want a baby in the future or ones who are going through fertility struggles. There's so much that you can do to prepare your body. We call this preconception work. It's doing all you can do to be the healthiest version of yourself. Start becoming the healthiest version of yourselves, both mom and dad, at least 3 to 6 months before conception. A big misconception is that prenatal life is all on mom, but this isn't true at all. Mom and dad play an equal role, especially in prepping for conception and the fertility phase of all of it. You are creating a baby that is half of you and half of your partner. So tip number 3, find your circle. This is so important. Surround yourself with people who protect your vision for birth. You want friends and family who are supportive of how you envision it all to go. Know an amazing doula. It's okay to establish boundaries around yourself during this time and say that you don't really want to hear about their birth story if it isn't going to be in a positive light. Find providers and align yourself with your vision and answer your questions. You should never feel belittled or irrelevant. Providers work for you. Tip number 4, nervous system health. And finally, the most important one of them all, making sure that your nervous system is adaptable and resilient so that whatever life throws your way, you and your baby can process through it and not store trauma within your bodies, but instead recognize it, process it, and adapt accordingly. So let's break it down. Let's start with the most basic understanding. The nervous system controls every cell, organ, and tissue, moms and dads too. A lot of the time, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles and miscarriages. Doctors love to run to the chemical imbalance of hormones. As this is true, is it the only root cause? This system regulation, hormones, decides which ones are needed at specific times. The nervous system, there's our root cause. When the nervous system is dysregulated, many common symptoms occur, things like cramps during periods, increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness, nausea, and blood pressure, constipation. Whatever the symptoms are, we can almost always trace it back to the nervous system. So how can you check if your nervous system is ready to make a baby, have a great pregnancy, and conquer birth and postpartum, right? The first step is to measure your heart rate variability. We do this at Healthstone Chiropractic using technology that is far more advanced than the Whoop, Garmin, and Apple Watches and Oura Rings. We love those gadgets for daily use, but this will tell us overall how your nervous system is adapting to stress and if your body's battery is ready to take on the prenatal season. This will also tell us baby adapting to stress as well. As whatever mom experiences, so will baby. So we need them to be adaptable too. We also will do 2 other scans that will tell us even more about your nervous system. Those 2 are also fast and non-invasive. They will tell us how your brain is communicating with the rest of your body, where you are storing and holding your energy, and how your nervous system is processing and dealing with stressors like trauma and toxins. The central nervous system is the biggest reproductive organ that we have. It controls all other organs and hormones, so we need it to be functioning at its best for preconception, pregnancy, and well after birth and postpartum. If you want to see how your nervous system is functioning, DM us and get your neurological insight scans scheduled right away. That way I can read them, look over your history, and create a customized care plan for you and your baby. We have the opportunity to impact baby's nervous system even before birth, which is wild, and I am so thankful for that. As we said, we aren't in control of many things, but when we can control how your system reacts to stress, there are better outcomes and hopefully avoid the norm that is happening so many kids today. For more information, visit the link in our bio or send us a DM to learn more. We can't wait to connect with you.